Um, so as you know, all of us are living under a very unusual time, one of the most dangerous times, at least in my lifetime, in the last 100 years, as we face this global pandemic. And so what we've been trying to do, in my lab at least, is understand how aspects of polarization and partisanship in the US have impacted the way that we've dealt with this global crisis. And so, as Kurt mentioned, polarization has been growing for many years, many decades, in fact, in terms of what people's beliefs are. They seem to be pulling apart in terms of Democrats are becoming more and more liberal, Republicans more conservative over time. What the research suggests is even more damning is nicely summarized in a recent paper we have led by Eli Finkel and many other colleagues who are experts in polarization. We've noted that over and above this ideological divide, what seems to be more prominent and causing more conflict is an affective divide, where people now find that out-party hate is a stronger force than in-party love and might be one of the most powerful predictors of our voting intentions. So it's not just that you disagree with people, even when you might agree with them or have potential grounds for compromise, you don't want to because you find them aversive or immoral. And so this moralization of political conflict has come with these consequences about how we feel about others. The other thing that seems to be coming with it is a very foundational disagreement on what the facts of reality are. And as Kurt mentioned, this is a challenge because fact checks are not particularly effective, especially in domains of politics. A recent meta-analysis found that it's much less effective than fact checks in all kinds of other domains. And so basic disagreements on facts are incredibly important and dangerous at a moment where facts matter more than normal. So we can disagree about crowd sizes. And in that case, the facts don't really matter so much. But if you're really motivated based on your partisan affiliation or identity to disagree about the risk factors associated with a pandemic that is, in the US alone has killed over 250,000 people, and you're debating whether or not to wear a mask or to distance or go outside, these types of things that reduce risk, or whether or not to have a Thanksgiving dinner at all this year, are foundational issues that scientists have studied. And if we're disagreeing on those basic things, even when there's lots of data on those issues, that presents not only a challenge of agreement, but a life-threatening situation for us. And so this is something that has really marked the way that Americans in particular have dealt with the pandemic. And so I'm going to show you data from surveys from last February to March. And what you can see is that there's big variation within states. So Democrats in Washington and Republicans in Washington both agreed, this was Washington state when the pandemic hit there first, that they were concerned about the coronavirus. But even though they were more concerned, Democrats are more concerned than Democrats from other states, and Republicans are more concerned than Republicans from other states. An even bigger divider was red versus blue. So it didn't matter what state you were from, whether or not there was a single case there yet, you were more concerned than people from every single other Republican state, even if they were facing an outbreak. And so a lot of us realized this might be a problem. This is going to be potentially devastating to people. But around the same time, researchers were using things like Google search and finding that although there's an initial divide in that Democrats are searching more for kind of like hand sanitizer and healthy things, in Republican districts over time, a few weeks, there was a shift where this partisan gap went away and suddenly Republicans seemed just as concerned about hand sanitizer. And so it suggested that maybe this partisan gap was something about how people talk to pollsters or the media, but wasn't reflected in actual behavior. And so, and this is something that happens if there's a distrust of pollsters or media, especially on the right. It's hard to know if they're being direct in some of their beliefs and attitudes. But at the time, I looked at all the data and I thought this is potentially a risky thing because if people don't take this seriously, it can lead to a large number of deaths. And so Anton Golitzer, who's a graduate student at Yale University, contacted me when he saw this article I wrote and said, well, we can test this. And he had data from 15 million smartphones moving around per day. And if you have a smartphone, your movement is being tracked. But these were anonymized, so we didn't look at any individuals. But we were able to look within counties and see how humans are moving. And this has really been foundational in this pandemic for tracking the transmission of the virus. As it moved up to other countries and as it spread within countries, movement was foundational to understanding who was put at risk and what we could do to potentially mitigate risks or see where risks were emerging. And so we decided to do this with the smartphone data. And what you can see here is data starting from March 9th and going till right after Memorial Day. And what you can see is that relative to the previous year, on average across the United States, there was increased distancing such that after a few weeks, by the end of March, people were distancing about 25 to 50% more, depending on how you measured it, than they were the previous year. So people were following the public health guidelines, taking it seriously across the country. What you can also see is as the curve of the pandemic started to flatten in the US, and people maybe got fatigued by this, and the weather got nice, that kind of combination of things reduced social or spatial distancing, such that by Memorial Day, people were out. They were back to their old behaviors in terms of like traveling. When we looked inside the data, and we compared red states versus blue states, or red counties versus blue counties, across over 3,000 counties, what we found is that there was a stubborn and consistent partisan gap, such that Democrats were engaging, people from Democratic counties were engaging in more distancing than people from Republican counties. And we measured this by looking at how they voted in the last presidential election. So people from Trump voting states were less likely to follow the guidelines about distancing. And you can see little bumps here when you look at reduction of general movement. That's because on weekends, people were more likely to stay home and follow the distancing guidelines. But on average, still during the week, there was this gap. And something that was surprising to me, I thought this gap might close over time as the pandemic spread across the country and people came face to face with it. But if anything, the gap actually got bigger. And so by the end of it, you had an even bigger part of the time we looked at it, the partisan gap was even bigger than when we began. And so even as people were becoming more familiar with the pandemic, these patterns of behavior continued to widen in terms of the partisan gap. And this wasn't just in these distancing effects happened, but it had consequences. So we looked a few weeks after each data point to see if it was leading to greater infections, and then even later than that, mortality. And this is exactly what we found. And not only did it lead to more mortality, but it seemed to be grounded in what media people were exposed to. So in counties where people were watching a lot more Fox News, this was associated with lower levels of physical distancing. So partisan media seems to play a role in people's behavior. It's filtering these messages to many millions of people. And then that seems to be predicting this lack of distancing in some counties led to increased COVID-19 infections in those same counties and greater mortality growth rates over time. And so this was done, in the spring. We just published this paper a couple weeks ago. And so this was really, really, to us, concerning findings. This wasn't just people's poll expressions on polls. It was manifest in the real behavior of millions of people that we could measure using these phone movement data. Some people have asked whether this is just conservatives or is it something about the party identification? One way to look at that is to go back to the last epidemic in the US. And what you find there when the Ebola epidemic was occurring was the exact opposite pattern, that Republicans, if anything, were more concerned about the pandemic than Democrats. And so what this suggests to us is it's not something about conservatives per se. It seems to be something about the specific party leadership and communication strategies in this pandemic. So it's something those things are often hard to tease apart, but this historical data gives us some clues. And then now you look 8 months later, and what you can see is that it's really the pandemic massively out of control, largely in red counties. And so you can see that just by looking at this map. It looks almost like an election map. And then here's the hardest hit states. So we found these same patterns in states. Here's what the worst hit states look like right now. As of today, I got this data about an hour ago. And so now you're seeing the massive consequences in the order of tens of thousands and hundreds of thousands of deaths of these gaps. I should say that we measured a number of other variables, economy, population density, a lot of these other things early on people thought might be accounting for why Democrats were taking it more seriously. Now we're seeing the spread in very rural areas, blue collar areas. And so, and our data bears that out. One of the most robust predictors was partisanship. And not only that, it was one of the strongest over and above all these other factors like spatial, how dense a place is, what the economics are, what the employment types are. And so this seems to be a really robust aspect of identity. And then you've seen this manifest in multiple multiple super spreader events hosted by the White House. Here's one at the Supreme Court nomination. When leaders are role modeling and acting like this, it sends signals to members of those parties about what is appropriate risks to take. You've now seen 3 outbreaks in the White House. This was from the Supreme Court nomination. I actually think that the outbreak here probably happened behind the scenes when they had indoor events, because we now know that aerosol is a primary mechanism of transmission of COVID. So if you're gonna do a Thanksgiving event with your family, make sure it's outside. I would not do it inside. And so even if you're together, do it in a way that dramatically minimizes the risks to you. And I also want to say this didn't have to be the case. So I'm Canadian. The data in Canada was suggested that identity could have worked in an opposite way. So in Canada, they analyzed, there was a study analyzing social media messages from Liberals and Conservative party leaders. And in Canada, they all expressed equal concern about the pandemic. And then when they did surveys of Canadians, they found that they, across the political spectrum, were far more concerned. And so when you present a common purpose and a shared identity rallying against a threat, that's something that seems to get rid of these effects of polarization and partisanship, which are also occurring in Canada. And it might have been dramatically life-saving. So even though there is a slight outbreak in Canada right now, it looks nothing at all like the US. It's not rising as quickly. The deaths per capita and hospitalizations per capita are over 100% lower in Canada. So even though there is still an issue in these other countries, it looks nothing like the US. So these are important issues. And so I'm going to invite, I think, Julianne next to talk about how we can start to talk to people across this type of partisan divide.